Hi, my name is Dr. Arvind. I'm an interventional cardiologist at Max Healthcare in New Delhi. The purpose today is to let you know more about coronary artery disease, its implications, and how we can do simple things in order to prevent a major episode from happening. We all know that of late, coronary artery disease is striking the younger population. This is more a result of our way of life and the food that we eat and the stress that we take in our day-to-day work. So the younger population should be very aware that they are predisposed to a heart condition, they are predisposed to acute coronary syndromes, and the prevention that they can take, very simple steps, is number one, they have to quit smoking. Smoking is doing us no good. It causes a lot of coronary vasospasm and causes a lot of plaque rupture. And this is the easiest risk factor that one can get rid of. Number two, though diet on itself does not play a very significant role and it's not considered as a risk factor for heart disease, but we can eat a healthy diet, and by healthy diet I mean normal home food. We should cut the fast food, which is rich in sodium, which is rich in fats, and we should try and avoid red meats as much as possible. Thirdly, and most importantly, is the prevalence of diabetes in our population, especially since obesity is gradually increasing year by year. The incidence of diabetes is also increasing many-fold, and one has to be cautious and do a routine check of his blood sugars levels to see that diabetes is under control, if at all it is there. And the best way to prevent diabetes from happening is to exercise regularly. Regular exercises in the form of brisk walking, at least for 30 minutes a day, will prevent a heart disease from happening. So when I talk about the major risk factors, I talked about cholesterol, I talked about diabetes, I talked about smoking. Another important risk factor is cholesterol, which must be kept under control. Now we all know about good and bad cholesterols, but amongst the bad cholesterols you have the LDL and the triglyceride. And I particularly feel that in our population triglyceride is very important, which can be controlled by watching our diet and by exercising. If the LDL is high and markedly high, most of the time it is genetic, it's inherited from your parents, and one would end up taking medicines for that. So you watch out for all the risk factors for heart disease, and if you have any such risk factors, then they have to be brought under control by lifestyle modification. If it does not happen by lifestyle modification, then one must make a visit to the doctor so that he can tell you exactly what medicines to take and what remedial actions to take. Once we've done the prevention bit, one must understand what symptoms to look out for so that you can reach the doctor quickly. Because in cardiology, time is essence, and the earlier you reach the doctor or the hospital, the better it is for you. The idea of asking one to walk every day is that he is doing a sort of a treadmill every day. So if a person tells us that, till yesterday he used to walk 3 kilometers very easily, and today he can't even walk 2 kilometers, we know that something is happening and this is the time to go to the hospital. So you're looking for exertional chest pain or exertional breathlessness or exertional discomfort. Anything which happens during exertion is a matter of interest to us. However, if you were sitting in your house and you had chest discomfort after food or while going to bed, the chance of it being from the heart is very remote. Most of the time, either you have a very major heart problem or it is not from the heart at all. So usually it is exertional chest discomfort that is important. If you were to have chest discomfort, the first thing to do is to take a tablet of aspirin and chew it, a 325 milligram of aspirin, and chew it and reach the nearest good hospital. When I talk about a good hospital, I mean it should be a hospital which has a cardiologist. There's no point reaching a small nursing home in your neighborhood, because they are only going to waste your time a little bit and then refer you to a major center. And here we are all trying to save time. So once you reach the hospital, within 6 hours of your chest discomfort, the doctor can do things to save your heart from a heart attack-like situation. So when you have a chest pain, which is a squeezing type of chest pain lasting for about 5 to 10 minutes, associated with sweating, this is the classical chest pain for a heart attack. And here it's best if you get hold of a tablet of aspirin, chew a tablet of aspirin, and ask someone to drive you to the nearest good hospital where you can be looked after. We have many modalities of treating a heart attack. Some would say that giving thrombolytic therapy, by which I mean that giving medicines to dissolve a clot, is good, but it has its own risks and it's not the best. The best is to do an immediate angiography and open up the artery by doing a primary angioplasty. Primary angioplasty is extremely safe and it gives us the best results, both immediate and late. There are 1 to 2% chances of complications in the form of progression of heart attack, in the form of fresh thrombus forming, but we have to take that in our stride, because greater than 95% of the population benefit markedly by doing a primary angioplasty. In short, what I would want to tell you is that keep your life simple, eat simple, exercise daily, check for your risk factors, check for diabetes, check for blood pressure, check for cholesterol, no smoking. The 5th risk factor is family history of heart disease, which you cannot change. So if you have your risk factors under control and you exercise 30 minutes of brisk walking every day, there is very little likelihood for you to develop heart disease. And just in case you tend to develop chest pain on exertion, reach to your cardiologist. He'll probably do some form of a stress test to prove that the chest pain that you have is actually from the heart and not because of any myalgia, any muscular chest pain, or because of any acidity. And once proven, he would want to do an angiogram, which one should readily agree to, because that is the best way of diagnosing, and subsequently a therapy can be designed.